Hey, welcome to the Healthcare Nation podcast. I'm your host, Rick Janata. And as we move forward with episode 3, we're going to continue with the big challenges, this time really focusing on integrative medicine as innovative medicine. And we've got a fantastic guest for this episode, Dr. Melinda Ring. Dr. Ring serves as director of the Osher Center for Integrative Health at Northwestern University. She's also clinical associate professor in the Department of Medicine and Medical Social Sciences. She did her fellowship in integrative medicine at the University of Arizona with Dr. Andrew Weil. At Northwestern, Dr. Ring directs medical trainee education and clinical and faculty fellowships in integrative medicine. She also founded the Cooking Up Health culinary medicine course and researches nutrition and integrative strategies, really groundbreaking research in that field. She's the chair of the American Board of Integrative Medicine, serves on the steering committee for the Academic Consortium of Integrative Medicine and Health, and serves on several editorial boards. In 2021, she received the Bravewell Distinguished Service Award, one of the highest honors in the field of integrative health. I am so happy to have Dr. Ring on the show today. Just a quick note and disclaimer, the opinions expressed are those of the hosts and guests and are for informational purposes only. I also want everyone to look at our podcast website, healthcarenationpodcast.com. Of course, our episodes are all on Apple and Spotify. So with that, let's welcome Dr. Melinda Ring.
So happy to reconnect with you.
Yes, absolutely. Good to see you too. Listen, there's so much that we can cover today, and I want to jump right in. Clearly, the current healthcare delivery system is not optimal. We've talked about this already with some previous guests. We know that that's going to be a thematic as we move forward with our other guests. Tell us about integrative medicine, the approaches specifically, including functional medicine, some definition and basics, if you could, just to level set the audience and I.
Sure. Well, it's been said that if you've met one integrative medicine doctor, you've met one integrative medicine doctor, because really it's practiced so differently by each person. But if you look at it as a whole, one of the definitions was created by who's considered the father of integrative medicine, Dr. Andy Weil. And he defines it as healing-oriented medicine that takes account of the whole person, including all aspects of lifestyle. It emphasizes the therapeutic relationship between practitioner and patient, is informed by evidence, and makes use of all appropriate therapies. And so I think a lot of times people think integrative medicine is saying, instead of taking this statin, take red yeast rice, or do acupuncture, or everybody should meditate. And that's really, while all of those integrative complementary approaches are included in our therapeutic toolbox, at its core, to me, integrative medicine is about preventive, proactive medicine, using the least invasive and most cost-effective approaches that we can to help heal people.
Well said. I've always believed, and I've been trained that, the least medicine is the best medicine. And I know you're deep interested in food as medicine, which is, we're going to talk about that in a second. But tell me a little deeper. One of the things that has been in the press most recently is the impact of integrative approaches, mindfulness, et cetera, on anxiety, also on pain and mental health. And I've always believed, again, speaking to the least medicine's the best, this has really tremendous promise when you think about it. Can you comment on that?
Yeah, I think mind-body medicine is actually starting to transition out of what's been considered alternative into conventional biomedicine. The data for doing mind-body approaches, everything from meditation to yoga, Tai Chi, all kinds of mind-body approaches, the impact on decreasing pain, like you said, on being equivalent to medication for mental health disorders is just so overwhelming at this point that it really can't be considered alternative and should be considered first-line therapy for so many of these issues that impact quality of life.
Now, with respect to that, if I could call it mainstream medicine or mainstream clinical care. What about access, particularly in the hospital and the acute care setting? Does it have enough traction? Is there enough of an advocacy role for folks like you to get out there and spread the word and educate so that these modalities can be, applied to the populations where it really has the most benefit?
Yeah, that's an interesting question. I mean, I think we need a few things. One is that we need an increasing healthcare force that is educated in how to talk to patients about mind-body approaches and other holistic approaches. So that's on the one side, is that integrative medicine is not a part of conventional biomedical training. And therefore, people are, today's physicians are uncomfortable bringing it up as a therapeutic option. The other aspect is that, as you said, the healthcare system is broken, and a 10 to 15 minute visit to cover all sorts of health issues is just not adequate for physicians and other health professionals to help guide people in those lifestyle approaches that are going to make the most difference for them. So I think, and then in terms of access, there is certainly access issues, and some of those are issues that our team at Northwestern is working on in terms of how do we bring this not just in the doctor's office, but into communities and train people in, for example, federally qualified health centers to teach people using culturally appropriate and sensitive language to incorporate these things into their care.
That's so important. And, it takes me down the road of thinking through new models of care and where integrative approaches fit. Also, and we've got to just face facts on this, who will recognize and pay for that, and the impact of, say, the consumer space, the retail space on this, and if it influences it at all. Can you tell us a little bit about, say, the perfect world of a model of care that completely embraces integrative approaches, the modalities you've talked about, and perhaps even what you're doing at Northwestern?
So your question is, what would my dream vision be?
Your dream vision, yeah.
My dream vision. I think integrative medicine, really the goal is that term just goes away, because if something works, if it's evidence informed, and if it helps patients, it should just be part of medicine. And so that's really the dream. And I think there's so much burnout in healthcare right now. Satisfaction rates among doctors and nurses is incredibly low compared to even pre-pandemic. And they also need to be nourished by these kinds of practices that help them cope with stress. So I think part of it is caring for health professionals and also giving them more time and compensating time and education of patients as valuable as getting a knee replacement. There's such a disparity between how our primary care force is compensated compared to interventional procedures that there's really no incentive for doctors to take the time with patients. They'll get more compensation by just churning out more visits.
Yeah, that relational aspect of communication and discovery when you're interviewing a patient, it gets lost when you have 5 minutes to sit down and go through a person's history. I could totally relate to that and understand that. Tell me, Dr. Ring, with respect to whole person care, with the end goal of influencing policy and practice, what does that look like, and are there particular barriers?
Let's see. Are there barriers? Well, there are many barriers to incorporating integrative medicine practices into healthcare policy. although some progress has been made in recent years. So, for example, in this past year, the American Board of Physician Specialties, which is the organization that supports the board certification exam in the field, lobbied and was able to get a new taxonomy code for integrative medicine visits. So this is, a step forward where at least it doesn't mean that doctors who use the code are actually going to get compensated differently for the visit, but it's a start to having traction in showing how many doctors are actually using it as part of their visit. There is just a huge lobbying force in biomedicine that has a lot more money behind it, and they have bigger presence in Washington, so it is an issue.
One follow-up on that. How about with respect to licensing along those lines? And you mentioned the certification. Do we have a good handle from the state and federal perspective of folks who hold themselves up to be an integrative practitioner, and those who are, perhaps, I hate to say it, dabbling in the field?
Yeah, that is a really wonderful question, and it's one where, I like to think that people are coming to their care from the right place, but there are bad eggs out there that are affecting the reputation of the field. There are currently, something like, 15 to 18 fellowships in the United States that are approved to train physicians in integrative medicine. However, there's nothing, no copyright, nothing that keeps somebody from hanging up their shingle and saying that they are an integrative medicine professional. And we see it, and again, I support chiropractors and acupuncturists and all kinds of providers as being part of our healing team. But the term integrative medicine can refer to anybody who's providing what they call integrative medicine. And because of that, we do see practices that are being offered in these clinics that that really are creating more scrutiny and hurting the field as a whole.
Yeah, that's really important when you think about that, obviously from a state level, regulatory, et cetera. I mean, really important point. Let me pivot one moment.
I just wanted to add one other thing. One other issue that I have seen in the field, and I wrote a op-ed on this a while ago, is that, what we're seeing is that there is some percent of physicians who have had a career, for whatever reason, for burnout or for other, have decided that they want to shift into integrative medicine and are practicing in a way that really goes beyond the scope of their initial license. So, for example, when somebody does a pediatric residency and then does an integrative medicine training and starts seeing adults, or vice versa. I was trained in internal medicine, and I personally am not comfortable treating children in my practice and wouldn't offer that up as a service because it wasn't part of what I was taught. So I think that's another concern, is that how are we defining scope of practice? Because that's really what licensure at the state level looks at. And issues like that are going to lead to, again, more challenges for the field.
Yeah, I could see that. Again, back to the regulatory side, the practice parameters, the scope of practice, how it is recognized with respect to, say, reimbursement or not, because I know a lot of this is actually out-of-pocket cash business. I hate to hear that folks would dabble or, if they're winding down, go into a field that, at least from my perspective, has so much to offer, but also requires a level of rigorous training to really become competent and to master what you've done.
Yeah, I agree.
Yeah. Let me switch gears really quickly. I know that you have expertise in women's health. I wanted to ask, with respect to women, men, and I would say even children or adolescents, with respect to integrative approaches, is there a self-referred preference, say women or is seeking out care from integrative providers, less with men, et cetera? What does the literature say?
The breakdown is actually pretty similar from what I've seen. Women traditionally have been more active seekers of healthcare, and children aren't seeking healthcare; their parents are. And so, the data usually shows anywhere from 30 to 60% of the population is using some sort of integrative practice, and a smaller percentage of that, maybe 10 to 15% of children, have used it within the past year. My personal specialty is in women's health, but I see men also. And I think, interestingly, and I've had wives bring their husbands in, that I've seen that men may be more open actually to entering through this more preventive, health-focused lens than going and being worried about getting diagnosis and being started on medications. So, but in general, the data still shows women are the leaders when it comes to access.
Yeah, and the decision makers, as you noted, for sure. There's no doubt.
Yeah.
I watched your TED Talk in Chicago. What a powerful story, and the road you took us down. It was just very compelling for me to listen to and to share with others. The whole notion of culinary medicine, nutritionology, the educational requirements or lack thereof of our medical professionals with respect to nutrition in that space, and hearkening back to the least medicine is probably the best medicine, and also food is medicine. Take me down the road of culinary medicine, its impact factor, what it's meant to you, and where you're going with this, with hopes, I think, of spreading the benefits to other practitioners and individuals alike.
Yeah, nutrition, like mind-body medicine, is something that I think has gained in acceptance in conventional medicine. But again, very minimal training in medical schools. And the vast majority of doctors on surveys, and even doctors straight out of training, state they don't feel confident counseling patients even on the most basic things around nutrition. A study of new pediatric residents showed that they failed a test on basic knowledge. So it's really a concern that out of the thousands of hours of medical school, so little of it is devoted to nutrition, when we know without a doubt that the food that we eat affects disease progression, disease occurrence, and should really be the first line therapy when it comes to any condition. There's a growing movement in the field of culinary medicine, which is defined as this idea of the art of cooking combined with the science of medicine and nutrition, and marrying those together, both for the health professionals and the students, which is what we do at Northwestern, and also for patients, because if we can, get patients in the kitchen and actually not just being given a handout on here's how you eat the DASH diet or an anti-inflammatory diet, but actually here's how you actually do it. It becomes almost like the surgery suite of nutrition. And that's really what we need if we're going to help people have behavior change.
So this goes into preparation, right? I mean, access to, I guess, fresh vegetables, other foods, meats, et cetera, and how you would prepare them in a way that really would give you the benefit, I would say physiologically, biologically, from a health perspective, that an individual would not get or understand in any other means except by a practitioner like yourself.
Yes. I think now there's just, of course, we still need nutritionists and health coaches and all of that. The idea is not that physicians take over that role, but they need to at least have the understanding of, hey, if I can do this, my patients can do this too. And this is, again, one of those areas where we're seeing momentum even at the policy level, where with the White House convening on nutrition last year, and then in the upcoming months in 2023, the associations that accredit medical schools and determine what the curriculum is actually having a convening next month to talk about how can we best teach nutrition in graduate medical and undergraduate medical education. So I think we are seeing some change here, and future generations of doctors will feel more comfortable training and talking to patients about nutrition. But honestly, what I tell people now is that don't expect your doctor to know too much about it.
Right. So let me ask you this, a practical question. How do we scale this? And I'm thinking about access for everyone. So communities that clearly have food deserts, or schools where perhaps the children who attend, the students who attend, that's where they get 2 of their 3 meals a day. Is there an opportunity there? And what does that look like from even a policy perspective, I guess?
What we're seeing, what we're doing at Northwestern, and what we're seeing being, I think, successful across the country, is thinking about collaborations between academic health centers and community organizations. So, for example, we've partnered with 2 different ones. One is Common Threads, which is a nonprofit organization that brings nutrition to underserved communities, teaching in schools across the country, teaching families in at-risk communities about nutrition through hands-on training. And so we have partnered with that wonderful organization. And then more recently, in the past year, we're working with the Cultivate Collective, which is a new site that is developing in Chicago, a community setting that will have a school, have teaching kitchens, have a working farm, have a nature garden, and helping them with the proof of concept. So if they can show that a whole community's health can be impacted by bringing these right to their doorstep, the goal is that this becomes something that is a model that can be replicated around the globe.
That's great.
So we need really the marrying of data along with implementation in order for scaling to happen.
Right. And I was going to follow up and ask you, what role does technology play in not only what you're doing, obviously with culinary medicine, the movement there, nutritionology, but even integrative medicine in general? Is there a role for technology? It almost seems in some ways antithetical, but when we talk about scaling, I'm sure there's tremendous applicability.
I think that one of the things that came out of the pandemic as a positive was the way that we can reach more patients who might otherwise have limited access. So, for example, when we look at our culinary medicine training, we could only accommodate 10 to 12 students in a kitchen at Northwestern. But over Zoom, when we all cook together, you can really expand that to an infinite range. And that's happened with organizations across the country. For me personally, in my practice, telemedicine has made it easier for patients to access me, where they don't have to drive downtown and pay for parking in the down Gold Coast of Chicago. So I think there is some benefits through this access that we're getting in technology. On the downside is that there is the risk of it becoming stratified by, does somebody have access to technology? Do they have a good connection? Are they comfortable using technology? So, for example, some of my older patients have more challenges when it comes to doing something like telemedicine. And so I think that there is a two sides of the coin when it comes to technology and access for the field. Now, there are some things in integrative medicine, which is by nature a very high touch approach that we lack when we start to try to do virtual care. So you can't do a massage virtually. You can't do acupuncture virtually. And so some things like teaching about nutrition, counseling on mind-body approaches work very well with technology. And then there are others that are just not going to work.
Yeah, great points. Really, really important too. So let's wrap it up with this. Your final thoughts, and where is the field headed? Integrative medicine, integrative health, the modalities, the approaches, in the future. What are your thoughts? You're clearly a leader in the field. You've been one of the, I think, sources of truth, if I could characterize it that way, for voices there. So tell us, Dr. Ring, where are things going with respect to integrative medicine?
Well, it's interesting because a couple of years ago, I would have said, I think integrative medicine is reaching a point, a tipping point. And what I see lately is maybe a little stagnation in that area. And some of that is because of other fields that are gaining more prominence, like functional medicine and lifestyle medicine. We're all playing in the same sandbox, and I'm certified in lifestyle medicine and functional medicine as well. So I appreciate what all three of these different areas bring in their approach to wellness. We just need to be sure that we're working together to change healthcare and not competing with each other. So I see good things ahead, but again, we need to think collaboration, not competition.
Right. It sounds like there's a little bit of growing pains in there too, as folks really embrace the opportunities that come forth with integrative medicine.
Absolutely.
Yeah. Well, Dr. Ring, thank you so much for being on the Healthcare Nation podcast. Phenomenal insights. Really looking forward to hearing more from you, particularly in culinary medicine. I think there's something that a lot of folks, not only in the United States, but around the world, are going to gain from that. And it looks like you're on the cutting edge of that movement. And I think that it's going to make a big difference for folks. So thank you so much.
Thank you. Thanks for having me, Rick.
Okay, take care.